It's always been there, standing between you and your health. A wall. Between a pain that won't disappear and a doctor who magically appears. Between a long wait on a hospital bench and staying right where you are, at home. Between finding yourself out of medicines and finding them at your doorstep, whatever the time. Between years of health records all over the place and all your records in one organized access from anywhere place. Between your current regimen and the recommended routine. The wall. We don't need it anymore. Say hello to Apollo 24/7. This is India's largest end-to-end omni-channel healthcare ecosystem, designed to touch more lives than ever before and delivering its promise in 3 important ways. 1. Listen. Talk to us anytime from anywhere. We've got 7,000 doctors and 30,000 healthcare professionals listening. 2. Advise. We'll give you expert advice you can rely on because it comes from India's #1 healthcare provider. 3. Assist. We bring you India's largest health network of pharmacies, clinics, hospitals and health insurance experts. 20 million people already trust us for their care, and a further 50,000 people are discovering this every day. Apollo 24/7. Expertise is for everyone.
Namaskar, welcome to Apollo 24/7's Health Hour. First and foremost, we are extremely sorry for the delay in starting today's live show. We were experiencing technical difficulties at the back end, and now we are here. Our doctor has been patiently waiting all this while. Thank you so much, Dr. Shwetha, for being with us. And let's start the show without any further delay. We are going to talk about vision loss, myths, and facts today. Before we introduce our doctor, let me also introduce you to the wonderful concept which is led by Apollo Hospitals, Apollo Foundation, and Apollo 24/7. That's called Saving the Child's Health Initiative. Saving the Child Initiative, which is SACHI in short, is a free pediatric consult for every child in need. You can access 10 plus pediatric specialties who are renowned Apollo pediatricians who are benefiting children across India, free consultations. If you know any child who requires this, please scan the QR code to know more and pass on the good word. And ladies and gentlemen who've been waiting for all this while, your questions I see on the YouTube, your comments, thank you so much for waiting. And here's the session for today. We are inviting our expert. Our expert today is Dr. Shwetha, who's going to join us very shortly. Dr. Shwetha is a senior consultant ophthalmologist at Apollo Hospitals, Jayanagar, Bengaluru. Her career is spanning more than 20 years. She is awarded National Award, Darsha National Youth Award in 2018, was awarded Vision Care Award for the year 2021, trustee at Paris Charitable Trust, Bengaluru. She has published more than 12 research articles. It's a pleasure and honor having Dr. Shwetha on the show. Thank you so much for waiting with us, ma'am. Thank you. Namaste and welcome.
Thank you so much, Jansi, for a wonderful introduction. It's my pleasure to be sharing my views with you today.
Thank you so much, ma'am. I know that people are waiting for their questions, but before that, quickly, I have a few set of questions. I see many questions and many people waiting for you, in fact. So the first and foremost, people have a lot of myths and misconceptions regarding eyesight. Let me start to understand how and when to visit an eye specialist, and only when I have a problem do I make an appointment with eye specialist, or does it have a protocol?
To visit an eye specialist only when you have an eye problem is the biggest misconception. So
Okay.
visiting any eye doctor should be every year, annually. A mandatory regular health eye test is very important because
Right.
most of the times we are not aware of certain conditions we have in our eyes. Maybe a gradual decrease in the vision like cataracts, glaucomas, which progress very silently. They are silent killers of the eyesight. So we
True.
do advise to have a regular eye test. And also many of us have thought that my kid is not able to read and write, so how I can take the kid to an eye specialist for eye examination. See, first and foremost, with this advanced technology, there is a lot of varieties of way to test even a newborn. So any newborn, if there is a suspicion from a pediatrician that there is an abnormality in the eye, obviously there will be an eye checkup done. But what I do suggest is as early as possible, that is by the kid when he or she is around 1 year of age, it is always best to have a generalized eye checkup. Thereby, school going age like 3 years, 5 years, then regularly every year do have an annual eye checkup.
That's an interesting observation, and I think people should make a note of it. Ma'am, also, a lot of things are, myths and facts. May having vitamin-rich food or certain amounts of food like carrots and other stuff will increase vision. Is that true? Will that help?
Well, for this question, I will answer like yes and no. The reason behind it is carrots are a very important vegetable loaded with vitamin, which is important for generalized eye health. But loading yourself with so much of carrots will not improve your vision, which is not perfect 6 by 6. Okay, so if you're
Yes.
already having a vision problems, like you're wearing glasses and things like that, eating carrots only will not help you improve the vision. Carrots
Okay.
have a substance called beta carotene, which gives rise to vitamin A by metabolism in the body. So that is very important for eye health. So what I'm trying to say here, only eating carrot will not improve the vision. There are so many other vegetables which take care of your overall eye health. Like there may be a reduced progression of cataract, or your macula can be, protected against degenerative diseases. So what I would suggest is you incorporate the vitamin A substances or vegetables in your diet and have a routine good diet. But loading yourself with carrots, which is a very minimum vitamin A requirement for eye health, is not at all good. And you can pack your kids with a lot of vitamin A, that is carrots, but don't expect a X-ray vision because just you are eating carrots.
Thank you so much for
Yeah.
giving clarity there, ma'am. One question about kids and spectacles. Once they're diagnosed with some kind of power and they have a spectacle, a lot of people, especially my friends, also think that if the children wear spectacles for a long period, they get addicted. So I make sure that my child doesn't wear it all the time. Is it true? Is it a myth or fact?
Addiction is a terminology where I can say it's a technical word where you consume something like, caffeine or drugs, you get a chemical inside where your body gets addicted. Wearing
Right?
spectacles, not having any chemicals, first of all. So it is not an addiction, maybe sometimes like an obsession, I can say. Because of spectacle, there won't be addiction. What happens is a child or an adult who has having a decreased or a blurred vision, when they wear glasses, the vision is clear. They have a clarity of vision. So they do
Yeah.
all the routine daily activities by wearing glasses because their vision is clear. So it is obvious that there is no addiction, but yes, they become dependent on glasses for their clarity of the vision, which is good. Otherwise, routine activities like reading newspapers for elderly people or kids to see at the projectors or long distance boards or driving traffic signals, all these will be a inhibition if there is a blurred vision. So
Yeah.
wearing spectacles is good, and have a routine eye test every year. If there is a change in number, change the glasses. If not, maintain the same spectacles and concentrate on a annual eye test, and rather than deciding yourself that spectacles is an addiction and making your kid not wearing it, it's a very big mistake, because the kids are growing, there is development of the eye, depth perception, binocularity, many things. If they have squint correction early age, if you use glasses, there might be possibility of crossed eyes getting straightened to some extent, lazy eye. By stimulating the lazy eye, or we call as amblyopia, the kids can have some amount of improved vision. And as we all know, eyes, when we see, the brain understands. So the logic for the kids is when they see, they learn. So
Yes.
indirectly, good eyesight is helping them to develop even in the brain and their activities, learning abilities. So if your thinking is like that, that spectacles is an addiction, you're not allowing your kids to wear spectacles or any eye lenses, there will be inhibition for learning. They will have obstruction, learning disabilities. So there are so many reactions happening, hand by hand with this. So it is very
Okay.
important to have a corrected glasses, wear them regularly, keep an eye test. If there is power change it, or keep on wearing the glasses. That's it.
Okay, now I also one of the YouTube viewers has asked a question about lazy eye. I shall surely come back to that. And somebody is asking about
Yes,
their child and their vision and the spectacles. I'll come back to those questions. But here, there's first and foremost, all of us have been experiencing online classes, either children or work from home. The digital age, there's so much of screen time and there are issues with digital eye strain. Let me start Dinesh Chandra's question here. Please advise IT professional working laptop about 10 hours severe dryness. And also there were questions where somebody has redness and dryness and watery eyes while they're watching the screen. What would you suggest, ma'am?
correct.
This is
So
Dinesh
this is
Chandra.
all symptoms. Yes. So, Mr. Chandra, all these things are symptoms of eye strain. Obviously, due to long hours working in front of any digital device, maybe a laptop or mobile phones or whatever. So, in this era of digitalization, we cannot say, please do not work, don't expose for the screen for long hours. So, we need to have some lifestyle modifications. For example, you can keep your system 25 inches away or at an arm's length. You can just take an arm's length and keep your monitor at an arm's length, and place yourself comfortably. Your eyesight should be, eye levels should be at least 15 to 10 to 15 degrees lower than the eye level, the center of the screen. If possible, don't use mobiles for long hour works. Shift to a bigger screen. Bigger screen is much less harmful to the eyes. Reduce the glare coming from the screens. You can put an anti-glare filters to your screen, or where, anti-glare goggles are available. To some extent, they protect your eyes. Then also, uh, use room humidifiers. Hydrate yourself, like keep drinking water. 8 to 10 glasses in a day is very good enough. Blink, remember yourself to blink, because we often forget when we are working. We focus on the screen, we often forget. So though the blinking is happening, but the blinking rate will be very reduced when you're focusing on something. So remember to blink. Keep a good lighting. Not Don't use the screen light. Should not be brighter than the surrounding light. And do not place your monitor against a window, because you know that sunlight and all will come onto your eyes. So all these small modifications can help you. And also follow 20-20-20 rule, what we advise to every IT professional. Like every 20 minutes, look at an object 20 feet away for 20 seconds. So 20
Oh,
feet away is a normal distance, what we a normal vision will look. Every
yes.
20 seconds, the blink rate will be 15 to 20 minutes, I mean times per minute. So that will help you to take a rest. Also, it allows the layering of the tear film on the cornea, so avoids dryness. In case you're already having dry eyes, evaluation of dry eyes, there are a lot of tests available to evaluate. You can go to an ophthalmologist. You can see whether it is mild, moderate, or severe. Accordingly, they will give you artificial tears, do some procedures like punctal pluggings in the eye. So all these things can help. And also take frequent breaks. Every 2 hours, take 15 to 20 minutes break from your work. That is also a very healthy lifestyle. Put some cold water on your face, splash cold water in the breaks, and try not to use screen when you're not working. So for your entertainment or something, you can reduce mobile phones. Seeing mobile phones in the dark light, like when you're sleeping, sleeping and holding it in above your eyes and seeing, all this can really harm your eyes, basically give
Okay.
you dryness and eye strain. So these are the basic
Done.
things which you can follow, and obviously your dry eyes will reduce.
Done, ma'am. Ma'am, Netra is asking next question. I have myopia. It is said that eyesight problems are passed on to generations. What precautions can I take so that when I get child, he or she will not get an eyesight issue? Is myopia hereditary, ma'am?
Myopias can be hereditary. What I mean to say is there is myopia also, there are so many grades of myopia. If there is a mild myopia or a moderate, and even if your partner is myopic, there is high chances of you passing on to your generations. But myopia as such, like what I'm trying to say is anybody having glasses could not be completely hereditary or genetic. This is a multifactorial. Wearing glasses
Okay.
are most of the times due to bad lightings, bad positions, nutritional problems, growth of the eye itself. See, the eyeball keeps growing from a childhood to up to 18, 20 years. So the axial length, or what we call as the eyeball size, if it is growing very rapidly, people land up using minus number glasses, which we call it as myopia. So netra, it is always better if you are specific about your age and the power. Suppose you're in the age of growing age and your power is abnormal, say it is more than 6 diopters, we call it as pathological myopia. So that has to be evaluated why this much power is there. So it needs a proper complete eye evaluation. And regarding you passing on your characters to your kids, may not be always 100% possible. If you are married to a normal eyesight person, maybe you're safe. And if you're married to a person who is having a high minus glass, chances of your kids landing up wearing glasses is possible.
Great, ma'am. Ma'am, there are a lot of people who are asking many questions. I know that we've started the session late, so I'm requesting my audience to type questions all at one go and kindly have patience because I have questions in the beginning. People who are waiting, I'll be able to take the questions towards the end, which have come later to in the later stage. Ma'am, Vishy is asking these questions. I'm having minus 1.5 on both eyes and cylindrical on both eyes. On both eyes, cylindrical are different on both eyes. Is it suggested to go for laser? What is a quick answer? Yes or no, ma'am? Here.
For me personally, no, as long as you are comfortable wearing the glass, because minus one with whatever cylinder, if it is a minimum cylinder, glasses are very safe. You can change the glasses. Laser corrections are basically came for high refractive errors. Those who are supposed to wear a very thick glasses, because the glasses will be cumbersome for them. They'll have a reduced field of vision because of the thick margin of the end of the glasses. And basically it was a cosmetic procedure rather than a curative procedure. So for this minimum power, I would suggest him to go ahead with the glasses. And also LASIK is performed only after 20 years, and it is more advantageous if you get it done before 35 or so, so that you can enjoy the benefit of glass or contact free life. So I would suggest Vishil to just continue wearing glasses and have a regular eye test.
Done, ma'am. Adish Jain is asking, I am experiencing itching and stingy and watery white mucus which comes out from my eyes every day. I started using refresh tears and Locular 20% once a week. It gave only very little relief. What should I do?
So these symptoms look more of allergic conjunctivitis. So he needs a very thorough evaluation, and we need to find out what is really giving allergy, what is stimulating his long-standing allergic reactions. Refresh tears are artificial tears; they do not really help in curing allergy or any infections. So there are so many varieties of allergic conjunctivitis. A ropey discharge will be related to seasonal conjunctivitis. Only watery can be due to some virus. A thick mucus could be due to some secondary bacterial infection. So please do visit an eye specialist nearby to know the type of conjunctivitis, what type of allergic, whether it is seasonal or any stimulant for the allergy, or it is all the year through, or any local reactions to anything. So you have to go for a course of anti-allergic tablets and also the drops. And we need to also do some blood tests if you're having long standing allergy to know whether the allergen cells are more in the body itself or any other systemic conditions inducing allergy to your eyes. So that is the best way to treat. Putting refresh tears or sometimes just going and buying on the counter drops may not help you much. So they may
Done.
rather damage, because rubbing your eyes will injure your cornea. So it's better to have an evaluation, and there is a protocol to treat allergy, and that has to be followed, because this comes with a course of medication, regular follow-ups, if required, blood tests, and then again changing the treatment.
ग्रेट मैम ग्लूकोमा के बारे में काफी सारे क्वेश्चंस है मिस्टर जगन मोहन रेड्डी इज आस्किंग अबाउट ग्लूकोमा also Banibrata Sen Gupta I think from Kolkata is asking about symptoms of cataract and glaucoma. I'll take the cataract later, but now let's
Yeah.
talk about glaucoma. Here is another question. Zaiba Masood. Good morning, Dr. Shwetha. I'm Zaiba. My eye problem is almost 4 to 5 year old. Lot of water now coming into my eyes, itching also. Left eye is very weak. Glaucoma is setting in. So, what is glaucoma and who needs to be careful about it?
Glaucoma is a very dangerous disease of the eye. It is called as silent killer of the eyesight. This is basically because as we have blood pressure, there is some normal range of eye pressure inside the eye. Because of the liquids inside the eye, they keep circulating in the eye to maintain the eyeball. So there must be some normal pressure which is ranging from 10 to 12 millimeters of mercury. So when this pressure raises, there is the damage of the optic nerve, which is a permanent damage, giving rise to blindness. This is a very slow growing procedure. And there are many types of glaucoma. There could be, just open angles, silently going, closed angles, coming very abruptly, or many things like that. So if the person who has asked this question is feeling that she is having glaucoma set in her one eye, she needs an evaluation. So if she has gone to the doctor, if they have recorded the pressure, if the pressures are more than 20 millimeters of mercury, obviously there would be some amount of raised pressure and we need to evaluate why she is having. So having said
Yeah.
that, diabetics, hypertensives are all more prone for glaucoma. So any pressure more than 20 millimeters of mercury, which is checked in your office IOPD, will suggest there could be a glaucoma, but it requires further investigations like visual tests, which test the peripheral fields, and we scan the optic nerve to know whether the glaucoma has damage. All this has to be set. And regarding her irritation, redness, and watering, could be due to an acute episode of glaucoma also, if she is already diagnosed with glaucoma, or else there could be some amount of conjunctivitis or irritation. So it's very difficult to say because a complete eye evaluation is required. If she is already a glaucomatous patient, she has to start the medications for glaucoma, keep checking pressures just like we check the blood pressure every frequently, and continue with the treatment, be compliant, or else this could be due to something else which the cause has to be treated.
Done, ma'am. Ma'am, here's Maria's question. Doctor, my son is 10-year-old. He's completely on online education. So is like the entire generation is now forced to get onto screens. Also, lockdown has pushed us and our children to screen time, which is like unimaginable. So now that he needs to do, which is a must on the screen, how can I make sure that his eyesight doesn't get affected in the long run?
See, first of all, a 10-year-old kid using digital or screens is definitely harmful, not because they will develop any refractive errors or need of glasses, because there will be a lot of eye strain. Though the kids' eyes are very active and healthy, they may not land up in the need of glasses. Suppose the kid is already wearing a glass, not because of the exposure to the screen. Anything which the close activities will not stimulate the eye to look away, look at a far distance. So definitely there will be increase in the number of the glasses. So it is not just the screen. Anything, if you are reading also, if you're just doing one near work for a longer time, the eye will not adapt to the longer distance. So what would I suggest any parent who are, very apprehensive for the kids using gadgets? We cannot tell them not to use because online classes are there. So do encourage them to have outdoor offline activities when they are not into the academic hours. Don't use mobiles or laptops for watching cartoons or movies or anything. Encourage them to go for out sunlight exposure for a minimum period of day, which helps in eye health a lot. Encourage cycling or any sports, incorporate good habits, maybe reading, drawing, or anything, and teach them, educate them about the hazards of using screen time. If you are using very less time and taking care, may not be much harmful to the eyes. So that is
Another
what I
question.
suggest. And definitely, yes.
you had given us the 2020 earlier for IT professionals
Correct,
who are working
correct,
screen.
correct,
Will that also
correct.
apply to children?
Yes, it can be applied to anybody who are using screen time for a longer period. But sometimes it may be very difficult for the kids, to for you to say, look away of 20 feet, focus for 20 seconds. Most of the kids are very hyperactive nowadays. They may not look at all. So that is the reason it's better to encourage them to some sports or any other activities. So just get rid of the screen and start playing. That way they will improve their overall development of physic and mental health as well with the eye
Done.
health. So, and also
Done.
I would like to add that ask her to take the child for a general examination. If the eyesight is normal, nothing to worry, just have annual eye test. If the eyesight is already bad, definitely whatever correction is required, the power glasses should be started at this age so that they don't have a blurred vision and handicapped life later.
Done, ma'am. Ma'am, here's
Yeah.
Kuti's Kitchen asking, my daughter's having lazy eye in the left and how to improve vision better. Quick answer, ma'am, because we're already at 11:42 and I have a lot of questions.
Yeah.
Yeah.
See, this lazy eye or amblyopia can happen where one eye will be stronger than the other eye. So it depends on the age of the child. If the child is less than 10 years, we advise patching of the good eye or the stronger eye to stimulate the lazy eye. So that all the activities can be done only with the lazy eye by just closing and avoiding all the rays stimulating the eye to the stronger eye. So that is the simplest way. So how much to patch, that will be decided by the grade of amblyopia or the lazy eye. And this has to be done when the child is very active in the waking hours, not when the child is sleeping. So if you close the eye when the child is sleeping, there is no stimulation for the lazy eye. So nowadays there are a lot of digital exercises, stimulations to the optic nerve to improve the lazy eye. So you can visit any ophthalmologist. They will definitely under supervision, they will advise you vision therapies. There will be so many stimulation exercises which can improve the eye. So do not delay and please start exercising your eye, lazy eye, by patching the good eye.
Done, ma'am. There are some technical terms which people are asking. My wife, Anand Tiwari ji पूछते हैं, wife is 37-year-old, has got cataract in one eye due to FUCHS syndrome, has been operated. What care should she take to, can it cause cataract in the other eye also? I was thinking cataract is only an aging issue. Now that it's a
No.
younger person.
No, no. This is the biggest myth. Everybody feels that aging and cataract go hand by hand. Cataract is nothing but the clear natural lens what we have. It starts becoming opaque or loses its transparency due to the proteins inside the lens getting accumulated. This can be due to variety of reasons. Like if it is in the youngsters, it could be due to an early onset of diabetes. It can be due to exposure to UV radiations. It can be due to thyroid eye diseases. It can be due to some kinds of medications like HCQs and things like that. Or sometimes any idiopathic cause, or even a newborn child can have a congenital cataract. So anytime due to any trauma or injury to the eye can also gives rise to cataract. So cataract is basically the transparent lens, natural lens, losing its transparency and becoming opaque. So for any type of the cataract, surgery is the treatment of choice. We remove the cataractous lens and we place an artificial intraocular lens in the place of the natural lens. So like any age-related cataract surgery, the same precautions and follow-up is required for all the cataract surgeries. So if she has developed one eye cataract surgery, it is always better to have a annual eye checkup. Avoid any chemicals without taking your doctor's advice on the counter drops or medications. If she is a diabetic, keep your sugars level under control. There is no chance of her developing the cataract in the other eye, but every year having an annual checkup would definitely give a clue. So wear protective glasses if you are going to a hazardous environment. And if you are having since she's 37, she must be having a reading difficulty in one eye because of cataract surgery. So she needs to wear a reading glasses for that. So these are the basic safety measures they can follow, and that will help her to have an idea about whether the cataract is, in the other eye is there or not.
All right, ma'am. I know it is a huge topic, but you condensed it so very well, all the important points there. Next question is Aditya Kumar. Ma'am, I'm 18 years old. I have a white circular ring around my cornea. Is this normal? Please pick my question. Yes, here's your question, Aditya.
White circle around the cornea. Cornea is a black part which we are seeing in front of the eyes. Sometimes happens only in the aged people, but this young man having this eye suggests there could be a increased cholesterol levels in him. So any increased cholesterol, lipid, or anything like that can give rise to a white circle around the cornea. Or sometimes there could be a white part of the eye will have some conditions which is encroaching onto the periphery of the cornea. So we can call it as a sclerosing cornea or scleritis, or these terms are used. So if he is having no other symptoms like redness, pain, irritation, watering, so it is better to get your lipid profile tested so that we come to know if there is any increased lipids, cholesterol levels in the blood. So that has to be treated for this white ring around the cornea. Or else any other conditions of sclera or conjunctiva which is giving rise to this whiteness or white ring should be evaluated and treated for.
Done. Here's an infant's question Vijay Kumar is asking. My son is 4 month old, suffering from sticky right eye after sleeping for 2 3 hours since born. Any remedy or treatment available?
4-month baby can have white discharge and stickiness if there is an infection in the eye. So, if this is happening from long term, that means there could be watering of the eyes, which the parents would not have noticed, or probably they're thinking it is normal watering. So, when there is a watering of the eye, the water collects in because there is a blockage, of the tear apparatus, lacrimal apparatus, which there is constant production of tears and drainage of tears. So the drainage is not happening. There would be a block in somewhere in the sac here. So the
Right.
uh, that tears are there in the sac and they get secondarily infected. So that
Okay.
gives rise to discharge or stickiness in the eye. First and foremost, you have to start an antibiotic eye drops to avoid this stickiness and infection, so that if this goes on for a long time, this can injure the cornea of the baby, which is very dangerous. Sometimes if there is any infection through the birth, like mother's vaginal delivery, if there is any infection, that can also give rise to infections of the eye. But since this gentleman's baby is having discharge in only one eye, so I feel there is a obstruction in the tear drainage system which is clogged inside the sac, secondarily infected and giving rise to pus or discharge, like giving stickiness. So it's better to start an antibiotic. Usually, we advise tobramycin eye drops to the babies because they're safe for babies. Uh, Obviously, you should go for an ophthalmic evaluation and start the antibiotic. And the ophthalmologist will try to assess the sac and lacrimal apparatus and give you the necessity advice.
Done, ma'am. Joy Kumar is asking, age 43 male. Problem is to related to CSR for last 2 years with a vision of 6 by 12 in the left eye. Problem has not resolved. Any remedial measures? What is CSR, ma'am?
CSR is called as central serous retinopathy. This is basically, if I have to explain, this is accumulation of fluids in the layers of the retina. We have almost 10 layers of the retina. So, in the center of the retina, that is around the macular area, what we call as central of the retina, the fluid accumulates, it is not drained properly inside the layers. So, there will be a elevation or swelling in that part of the retina. So, there will be a very difficulty or blurred vision for seeing in the distance. This can happen due to many reasons, most commonly in a type A or an anxious personality. They can have commonly stress related, yes, or any sometimes hormonal imbalances or secondary to certain medications. All this can happen. So if person has visited the ophthalmologist, initially we assess how much the fluid is accumulated by doing a OCT, called an investigation, and then after that we do advise some anti-inflammatory drops, wait for it to resolve. But this seems to be a very long standing, it is almost 2 years, and by this time the layers of retina would have had permanent changes. So his vision is 612, which is not very bad. It's decent enough. So it's very difficult at this time to really treat. So it's better to keep a follow up so that it doesn't worsen any further. Some ophthalmologists shoot laser for the absorption of the fluid, but 2 years down the line, I wouldn't say it will help him improve the vision much. So it's better to keep the other eye, follow up every frequently with the eye doctor, and just keep in touch with the doctor not to worsen the vision and keep the other eye in a perfect condition.
Ma'am, next question quickly because I need to wrap up in a while. Robin Tivana is asking, diagnosed with J open angle glaucoma. My pressure was 15 when diagnosed. My mother already has glaucoma. I'm having vision loss even. Why am I having vision loss even if I have IOP of 15?
This open angle glaucoma, yes, the person is saying mother is also having open angle glaucoma. It's a juvenile condition which is happening in the youngsters due to hereditary glaucoma. So even if the pressures are maintained, the person was not really told me whether his pressures are maintained with medication. Suppose assuming that the patient is already aware of the condition and probably he is on treatment, maybe the patient has developed resistance for his medications. So though the pressures are 15, sometimes the pressures will be normal and the damaging process of optic nerve keeps on going. So I would suggest him to go have a perimetry visual field analysis done, get a optic nerve head imaging, and have all the tests of glaucoma. If the patient is compliant with medication, regularly using the drops, and still his vision is dropping, that means he needs further more evaluation and treatment, like maybe a laser procedure. So because maybe he's using a drops which is just helping him drainage of the aqueous, there may be more production of the aqueous, so the mechanism may not be proper and he is using the medications, still pressures are maintained, worsening of the eyesight is happening. So he can go for a laser procedures to control or avoid the worsening of the vision level.
Thank you so much for taking time there, ma'am. Ma'am, Girija is asking, mother is 73-year-old, cataract hair and hole in retina in both the eyes. Can the defect in the retina be corrected and will there be vision loss?
See, cataract and retinal diseases, if they are having both together, we have to assess what grade of hole she is having. I assume that it is a macular hole she is talking about. So this could be possible in elderly females rather. So they can have a cataract, and if the ophthalmologist has seen a macular hole, I assume that the cataract is not very mature. So when we do a OCT of macula, we will come to know whether the hole is grade 4 severe hole or early grades hole. Early grades hole can be definitely treated by combined procedures. We can combine cataract and retina procedures. When we do a vitrectomy and try to close the holes, it is possible. But the patient should understand that, like any other cataracts, which is a very less complicated surgery, when we do, the vision quality may be not as good as just cataract surgery, because there's already a hole in the retina. There will be a compromised vision. The ophthalmologist operating will definitely explain to them there is a guarded visual prognosis in this patient, but definitely she has to undergo surgery, and it is better to go for a combined surgery rather than just do a cataract and land up not correcting a hole. If the hole is in the severity of treating level, it's always better to go for a combined surgery. But the patient should be well informed and understand that the vision improvement may not be 100% like any other cataract patients.
Done, ma'am. Reva Ravipati is asking, ma'am, I have got a PRK procedure done. It's been a month. I have slightly loose epithelium according to the doctor, and they asked me to continue drops. How long will it take for a full recovery?
PRK procedure I feel she can wait for 1 more month. Sometimes when they put back the flap may not really sit well after taking out the flap and shooting the lasers. This procedure is basically done for correction of the spectacles, just like any LASIK. So it is a type of refractive surgery. So whenever there is flap related problems, it is always better to wait for certain time. It is just a month. She can continue putting her steroids and lubricant eye drops, and then visit her surgeon who has performed. They will evaluate again if the flap related problems are there, if the flap is sitting well, or if there is any accumulation below the flap, or if there is any infection or flap related complications. Then they will definitely advocate a corrective procedures. If they have
Done.
told that you can wait for a month, I assume that there is no serious issues with the flap. It is just that maybe it is not healed up well. So it is advisable to wait for a month again. Put the medications regularly and wear protective glasses till she is, not completely healed. Have a evaluation. If the flap is sitting well, nothing to worry. Otherwise, a corrective surgery may be required.
Yes, ma'am. Macular retinopathy के बारे में lot of people are asking. Macular degeneration, macular retinopathy. Mohammed Sharif has asked, and a lot of others also have asked. What is this? And quick tips to take care of this.
Macular degeneration is most commonly nowadays. This is, cataract, and other than cataract, macular degenerative disorders are the most common cause of blindness and worldwide, I would say. This is basically happening due to aging, sometimes age-related macular degeneration we call. Some people who are chronic smokers, diabetes, hypertension are all the risk factors for developing degeneration of the macula. So this is nothing but macula is a central area in the retina where there is a central vision, or where there is a sharp vision, I can say. So the cells or layers of this area start degenerating or start getting damaged. This is a permanent damage. There is no means that we can really correct it or give back the vision what they have lost. So the best thing is to avoid this. If you are a smoker, please quit smoking. If you are diabetics or hypertensive, please keep it under control, because these are the modifiable risk factors. See, there are risk factors which is not in our hands, like genetics. If there is a macular degeneration due to genetics or something, we cannot do anything. But these are the risk factors which is definitely can be modified. So keep it under control. A very healthy lifestyle, diet, exercises, and regular visits to your eye doctors. This can be treated if there are varieties of degenerative diseases in macula, like we call it exudative, non-exudative, many things. So if it is coming under category of treatable, we give certain kind of lasers as treatment. And sometimes some ARMDs like macular degenerations are not possible to treat. We give special lenses called low vision aids. These are magnifying lenses which can at least help the patient to have a daily day-to-day activities without hindrance. So please focus on having a healthy lifestyle. Do not cultivate bad habits. Good diet, moderate exercise, and a regular eye test and generalized health concerns will definitely benefit.
Yes, ma'am. Ma'am, before I leave, I should first apologize and we've taken too much of your time and also audience's time. But thank you so much for bearing with us. Lastly, before I conclude, there are a lot of people who are asking, can I get rid of my spectacles, any eye drops or anything that I can do and reduce my number? With that, I would want you to answer them as a top tips. Give us some tips. How can I get my number down and maintain spectacles or good vision?
So, spectacles, if it is for youngsters, there is no drops available for any age to get rid of the glasses. If you are already using spectacles, if it is a very minimum number, please maintain it. If the youngsters are above 18, say 20 up to 35, you can go for laser corrections, get rid of your glasses or contact lens. And elderly people who are using reading glasses, nowadays there is laser correction even for near vision, but it comes with its own pros and cons. So maintaining a healthy lifestyle and having a regular eye checkup is, and having a good diet is the motto. But once you get the glasses, there is no medications to get rid of your glasses. In case you do not like to wear, for cosmetic purpose, you can shift to contact lenses. But contact lenses, yes, again, you will have to maintain hygiene, removal, application, wear it for only 5 to 6 hours a day. All that is important to maintain. So I would say there is no way to get rid of glasses. You can just substitute them with contact lenses or laser corrections if possible. That's it.
Thank you so much, ma'am. Ma'am, before I take leave from you, I have spotted a very important question here. Trustline is asking 15-month-old child, problem in right eye, his normal indoor, even light bulb, he is not opening one eye, outdoor, especially in the sunlight. He's covering right eye by hand. One last question, ma'am. I didn't want this person to go away disheartened. Yeah.
So the no problem. So this 15-month baby may be having a severe photophobia is one possibility.
On
If
one
the
hand,
eye
ma'am,
is not right,
photophobia is
exposure to sun or light is not bearable
even
by
in
the
one
child.
eye, there can be
Uh,
photophobia, is it,
one
ma'am?
eye. So that's what. So that is what I'm coming to it. So
Ah,
possibly possibilities if there is no other symptoms like the child is constantly closing only one eye. That means the child either is having a problem in the eye or the other eye vision is good and it is not able to see from the eye which is closed. So that is why it is possibly focusing from one eye. It is trying to close one eye and just see. So or there could be some irritation in the eye. It is trying to close and have a soothing effect. So this baby is really needs an evaluation. If there is no symptoms of watering or anything, maybe there is a vision abnormality. So it has to be evaluated and corrected as per.
thank you so much, ma'am. Shanti Yogini ji, your question, we can't take the question as an independent question, but doctors answered all the glaucoma related issues. So I appreciate your patience in asking questions. Thank you, Dr. Shweta. Appreciate your time on a Sunday morning. Thank you.
Thank you so
Thank you, ma'am. And here's the health quiz coming up. Sorry, we lost doctor's connection there. Health quiz, I'm going to ask you three questions on the YouTube chat. You need to reply. The winner's name will be announced towards the end of the show, and we shall be announcing the winners. And Apollo 2417 will announce the winners at the sole discretion. Once you are announced as a winner, please write back to us at marketing@apollo247.com. Gift vouchers will be shared with you. The three questions for today are: question number one, what is the common term for myopia? What is the common term for myopia? We have discussed quite a lot about it today. Question number two, which month does World Sight Day fall in? What month does World Sight Day fall in? Question number three, which feature on Apollo 24/7 app allows you to book blood and urine tests? Which feature on Apollo 24/7 app allows you to book blood and urine tests? These are the three quick questions for today. Type them down on the YouTube chat. In the meanwhile, while the winners are being selected by our team, let me also give you wonderful coupons which are waiting for you. Instant consultation, one tab at rupees 1 only on the Saturday and Sunday. So Saturday ho gaya, aaj Sunday hai. 1 rupee mein you can consult general physician, gynecologist, dietitian, a urologist, and also a dermatologist. These are our special offers for today, limited seats. So better go ahead and book your consultation. One tab at rupee 1 only. So this is valid only for Saturday and Sunday. And today is Sunday, I remind you. Then the next question, next coupon that we want to talk about is first three. It's a payday sale. First of every month, we get back onto the payday sale. Flat 25% on online medicine orders. Avail to our free delivery. Also get up to 300 rupees assured cashback if you pay via Paytm wallet. This is valid on first three online medicine orders about 1,000 rupees. So go ahead, payday sale का इस्तेमाल कीजिए. Thank you so much, all of you, for bearing with us. There was a technical snag in the initial 10-15 minutes. I wish we had that little time also to address more and more issues and questions. Dr. Shweta was really very patient. She had given such elaborate answers. In case if I've missed any of your personal questions, you will definitely find an answer in what she has answered for somebody else's query or question. Thank you for bearing with us. And here are the winners of today's quiz: Tummalapalli Madhuri, Sumit, and Sai Lakshmi. Congratulations. Please write back to us and claim your gift vouchers. We shall meet you next week. Next week, we have a very interesting topic. Uh, yes, why is skin cancer on a rise? We are going to talk about it next week, 10th April 22, 11 a.m. By the way, did I announce the HH247 earlier? Screen pe aapko coupon codes dikh rahe the, HH247. Please go ahead, utilize those coupon codes on Apollo 24/7 app, and you will be able to consult doctors and also get 199 mein consult kar sakte ho, and also get 20% off on your medicine deliveries. So see, we shall see you next week. Thank you so much for all of you and your vision queries. It was an interesting session. Thank you, Dr. Shweta, once again. Namaste and bye bye.